同胞，因为武汉这个事情，武汉这个瘟疫，都是有计谋、有计划发出来这个瘟疫，牺牲的是我们平民老百姓，我的家人，我的父母在家等死，没有人关心我们平民老百姓的性命，有钱也买不到药，有钱也买不到病房。然后香港同胞，你们独立我支持，台湾独立我也支持，西藏、香港独立都支持，摆脱共产党的邪恶手爪，腐败的政权，邪恶的社会，没有一个人可以自由发声，没有一个人，只有一个人自由发声，就去警察局喝茶、拘留、判刑，法律是他们判的，他们能说判几多年就能判几多年，律师都没有用的，有一个正义的律师都会关起来，他不会为正生而说话，因为他们有邪恶的政权压迫下，不能正的说话。我要告诉你们，一个人牺牲，两个人牺牲，革命肯定是有血有肉来牺牲。我想站出来，我暴露出来，我就要站出来，我就要牺牲，为我的父母，为我的家人，为我以后的后代可以自由的生活。我发声，我也很危险，我也知道，但是我已经受不了了，没有病床，没有医药， CCTV 讲的那个新闻全部都是假的，全部。他们的吼声，他们的叫声我看到了，我要发声，我要为我自己发声，我要为我武汉的人民发声，我要为中国同胞发声，就是有养老金，他们想把这个养老金废掉，搞这些事情，这种邪恶的政权，我真的不想再真的不想再沉默了，我要发声了，我要疯了。没有一个人可以站出来，我现在站出来了，一定要反抗，一定要反抗啊，同胞们，不能再让他们宰割期呀，才不能再可以这样了，为了下一代站起来，真的是站起来呀。
Here's a summary of what we know and don't know about COVID-19. By John Lundy. What is it? COVID-19, the name applied to the disease as of February 11th by the World Health Organization, is an acronym CO for corona, V for virus, D for disease, and 19 for 2019, the year in which it was identified, although not until very late in 2019. Coronaviruses commonly circulate among humans, according to the U.S. Centers for Disease Control and Population, and cause mild illnesses, such as the common cold. See also, Northland preps for COVID-19. COVID-19 is a new and more severe form of coronavirus, first identified in Wuhan, China, and is believed to originally have been transmitted from animals to humans. What are the symptoms, and how do they differ from cold and flu symptoms? Symptoms are similar to influenza symptoms, said Dr. Andrew Thompson of St. Luke's Infectious Disease Associates. Fever, muscle aches and coughs all are early signs. But you can't have COVID-19 unless you're around someone who has it. So far, no one has been confirmed with COVID-19 in Minnesota, although one case is being tested, according to Chris Arisman, Infectious Disease Director for the Minnesota Department of Health. One case has been confirmed in Wisconsin, but that individual is in isolation, said Chuck Warzeka, Deputy Administrator of the Division of Public Health. So if you haven't traveled to where there are cases, you don't have it. What is the fatality rate? During a news conference Thursday, Dr. Ruth Linfield, Minnesota state epidemiologist, cited data from the Journal of the American Medical Association reporting an overall fatality rate of 2.3% in China. In comparison, she said, the H1N1 influenza pandemic of 2009 had a fatality rate of 0.1%. The 1918 flu pandemic had a fatality rate around 2.5%. Most of the cases in China hit people between ages of 30 and 79, Linfield said. She also noted that the fatality rate from COVID-19 has been much higher for people in their 70s and older than for the general population. What should I do if I think I might have COVID-19? It would be good to call your clinic and tell them your symptoms and concerns, Thompson said. We would like to know ahead of time when people are coming in with that complaint. If you meet CDC criteria for being at risk for the disease, a swab can be taken to find out if you have it, but currently, it still has to be sent to the CDC to be evaluated, he said. Depending on how ill you were, you then either would be admitted to the hospital and isolated, or sent home with instructions to isolate yourself until results were obtained. What preventative measures can individuals take? A vaccine for COVID-19 and antiviral drugs is months or even 1 or 2 years away, Minnesota Health Commissioner Jan Malcolm said during Thursday's media briefing. That means non-pharmaceutical measures are the only line of defense. If they sound familiar, it's because it's the same recipe to avoid spreading colds and flu. From Chris Arisman. Cough into the crook of your arm. Wash your hands. Keep in mind that good hand washing means washing your hands with warm, soapy water for at least 20 seconds. Avoid touching your face. Stay home if you're sick. Should we be more concerned about flu or coronavirus? Flu, properly washed, hands down. We've had one case of COVID-19 in this state, said Dr. Ryan Westergaard, Chief Medical Officer for the Wisconsin Department of Health Services, during Wednesday's briefing. The number of influenza cases is approaching 20,000 now. As of Thursday afternoon, 15 cases of COVID-19 had been confirmed in the United States, according to the CDC, and there had been no deaths. As of February 15, the CDC estimated 280,000 hospitalizations in the U.S. for influenza, and 16,000 deaths. Even in Minnesota, which has taken a relatively light hit from the flu, there have been 2,817 hospitalizations so far this flu season, and 67 deaths, according to the latest data from the Minnesota Department of Health.